The Susan Brender Show is a radio show online broadcasted on YouTube across the United States and globally. The show features guests who speak about health, spirituality, entertainment, and a host of subjects to enlighten people across the nation. Listen to the show that empowers women and men alike and highlights those who have made a difference. I'm Susan Brender, and this is the Susan Brender Show. Today, my guest is Scott Miller, who's a physical therapist in Florida who's practiced for years and years and who has the experience to do the work that is so important for people who are suffering from various injuries, various problems that they've had, maybe even as a child. And today we're going to talk about the Millenniums, because Millenniums in general, and I'm saying this in general, and Scott is going to be able to address this. In general, they do a lot of bodybuilding and spinning and exercising and jogging. And sometimes as a result of all these things that they do, they hurt themselves. And they realize afterwards maybe they shouldn't have done it, but on the other hand, that's part of their generation. So, Scott, let me ask you something. You've been working with people of all ages. Tell me a little bit about the Millenniums and what it's like to treat them, and tell us what kinds of problems you see because of all the work and all the exercise that they do.
Well, thank you very much for having me on your show. But once again, I love being part of your show, and be happy to give all the information and input that I can. And with millennials, it certainly can be an overuse type of injury where they are kind of excessively working out, whether it's going to the gym, like you said, or going to a spin class, or whatever type of movement and activity that they are doing. And what has been very popular with the younger generation are some of the high intensity workout classes. And and not just with millennials, or not just with the high intensity exercises. If at any age group, at any exercise, at any movement, if you're going to overdo it and do anything in excess, it's going to pay a toll on your body. So you're seeing it just a little bit more and more, because these new types of classes and these new types of programs have become very popular. So you are seeing a lot more injuries because of that.
Yeah. And something, Scott, I've seen people do this spinning, and when I watch them do it, I know, and I feel, I'm not an expert at this, but I have to let you know that it looks over excessive. The people who run these places, they push them and they push them. And as a result, I'll give you an example. I have a cousin who did this, and she wound up with a really weird disease. I don't remember the name of the disease, but it was as a result of the spinning, because they're pushing you, and you think, well, they know what they're doing, but do they really know what they're doing?
Well, with any type of exercise, not just spinning, you can certainly cause overexertion. You can cause dehydration. You can cause kidney issues if you are overexerting and your muscles are expending way too much energy. And a lot of times these signs and symptoms are not really known from the instructors or the trainers or the individual until sometimes it is too late. And you do see the overexertion injuries quite often, whether it's musculoskeletal or it becomes a systemic issue, like your cousin experienced, which can certainly become very, very dangerous if it's not paid attention to, and you don't know the symptoms, and it could certainly be too late.
What are your organizations? I assume that there's a physical therapy organization that gives advice and talks about these issues that we're discussing. Have you experienced, or have you read something that tells people that they're doing danger to their bodies at all? I mean, who advises them? Do you advise them?
Well, we advise patients that we do see about the right level of activity and what if they're coming off an injury, how to get back into levels of activity that they're looking to do, and how to avoid injuries and issues in the future, and certainly kind of see what they have been doing, maybe what has caused these injuries and these conditions, and we really try to guide their movement patterns and guide their overall exertion levels to a more normal level to prevent these conditions and injuries. And as far as any published research out there, there's quite a bit of research out there that evidence studies that has shown what overuse and overexertion can cause. Now, is everybody that's going to work out going to be reading these articles and these research studies? Probably not. And that's where a professional like myself, a physical therapist, your primary care physician, your whole medical team certainly can give you the right advice as far as what should and should not be doing.
I'm curious about this. When somebody comes into your office and they tell you, well, my shoulder hurts, my hand hurts, my leg hurts, and the audience understand what a physical therapist really does, because I don't know. I know people go to chiropractors, they go for massage, they do various other things, but with regard to a physical therapist, how does that work?
Well, physical therapists are movement experts. We respond to any limitations that patients have with specific movement patterns, specific strengths and weaknesses, and more specifically their level of function. So if a patient comes in and they have any lack of mobility or a lack of function, they're not able to do a specific movement pattern or an activity level, we're going to break down the specific movement, and we're going to develop a program that's going to get that patient back to their prior level of function, whether it's a simple exercise or simple movement like walking, or it's a professional baseball player that we're trying to get them to be able to throw the ball again. So it's just a matter of an individual level of function that we need to look at specifically with each and every patient.
Yeah. Do you work together with usual doctor, a medical doctor, to give this person a little bit of respite from the pain that they experience when they're hurt?
Sure. We work closely with the entire medical field, whether it's a patient's primary care doctor, their pain management doctor, their orthopedist who may have done surgery or we're trying to prevent surgery, and even the chiropractor that might be part of the patient's medical team to really help as a whole team approach to try to alleviate their symptoms and their pain. And some of the medical team is responsible for medications if needed. Some are responsible for just kind of guiding their entire program. Like the primary care is really there to guide them and get them to the right practitioners to enable them to achieve the goals that they're looking for, which includes sending them to the right physical therapist, sending them to maybe the right specialist to look at the specific issue that they're having.
You just opened up a good question for me. And what makes somebody a good physical therapist? How different is Scott Miller from some of the other physical therapists in the world?
Well, it's a matter of how you look at each individual patient and not looking at someone's shoulder injury as just a universal shoulder injury, and it's not just a cookie cutter type of body part or type of a program that we have. So, and that's where the individual physical therapist is going to really bring out their skills when they evaluate a patient. So, we may have a specific diagnosis that we've received from the physician, but we're going to do our thorough analysis and evaluation on a patient and come up with our hypothesis, our own diagnosis for each and every patient, and develop our plan of care. So that's one way that a therapist can differentiate from other therapists, is how they can really see individual patients and individual injuries. And that comes with experience and, of course, what we've seen in the past as well. Another part of our skill, which differentiates the therapist, is our hands-on ability to treat a patient as well. So, that's where a lot of our skill comes from, is our hands-on, soft tissue manipulations that we do with patients and how we stretch patients. And every therapist does have a little bit different touch, and that certainly can differentiate how how that can alleviate pain and improve a patient's function with what we do hands-on.
Yeah, and I'm curious about this. When people are in pain, psychologically, it's the most horrible thing. I mean, pain is, what can we say about pain? I mean, pain is pain. And there is an attitude, as far as I'm concerned, that one has to believe in, which is that they're going to get better, okay? But a lot of people who are suffering for a long time don't think so. Now, do you deal with the mental side of things? In other words, do you try to encourage them to do certain things that's going to make them feel better physically as well as mentally?
Absolutely. The mental capacity of handling an injury is probably even more than 50% of the actual injury itself. And as physical therapists, we do have to have quite a bit of a background and education with psychology and how the brain works with the pain receptors and there if we cannot control how a patient perceives pain or how they're dealing with the pain mentally, it's going to be very hard to overcome the physical pain that they're experiencing as well. So there are certainly techniques that are done. There are breathing techniques. There's meditation techniques. There's and just sometimes just talking to a patient and talking to the individual and just understanding that letting them know that we realize accepting that the fact that they do have pain, and that's sometimes patients and clients that come in just don't have that someone to talk to about their pain. So just letting it out and getting to talk about it can really help the whole mental game of pain.
When you started your practice, you must have seen certain kinds of injuries and certain kinds of ways to deal with it, but you've been in business for quite some time. Has there been a change? Is there something that you've added to the way you take care of people?
I've been in practice for 14 years now, and the science behind physical therapy has not changed too drastically. There's always new manual techniques that you learn along the way, not necessarily new that they just came out and they're state of the art, but maybe just other techniques that you continue to pick up along the way because you can't learn everything all at once. So you continue evolving as a physical therapist, and you continue learning new techniques. And there are some new modalities and technology that does come out that in some cases it does help some patients, and others it the traditional physical therapy, the hands-on approach, and the exercises that have been around for years and years are really the best the best therapy that's around.
Yeah. What do they call, tensors or some other thing that you put on somebody's body that will magnets in them? Do you use that?
We don't use any sort of magnetic type treatment. We do use some modalities. Modalities include like electrical stimulation, and that is more like electrical impulses that help stimulate healing. It helps stimulate blood flow to an injured area, which can help promote healing. It helps loosen up muscles. It helps with muscle spasms, and patients seem to really respond well to some of the electrical stimulation treatments that we use.
Yeah, and also, Scott, when people come into your practice and they look at all the equipment that you have, do they start to tell you, this is like over my head, I'm afraid to use these things? What kind of conversations do you have with, say, older people who have been injured or have hip replaced or their knee replaced or one of these things? They are in pain for the most part, and it lasts for quite some time. And I'm just curious what you say to them. Can they do this? I mean, they're like 80 years old or 90 years old. Can they do things that younger people can do to enhance their ability to be healed?
Absolutely. You know, every patient is going to be at a certain level. So whether it's at the level 1 type exercises or level 10 type exercises, there's something for everyone. We, you know, in my practice, and I know, you know, a lot of physical therapists believe in this too, we don't really need a lot of high-tech gym type equipment in order to treat patients and to properly, you know, get them to where they need. You know, body weight exercises using very light weights can be used very, very effectively to achieve the goals that we're looking to achieve, both with elderly patients that are just learning how to walk again, or your high-level athlete. And a lot of these exercises can be done here at the office, but also we try to do a lot of stuff that you can do at home as well, so that they can continue with the program that we're doing here, because it's only, you know, doing movements and exercises twice or 3 times a week really is only going to do so much. These patients, we're really here to educate patients on doing the right stuff at home and changing their program and routine to achieve the goals we're looking for.
What about diet? Does diet play a role at all?
Diet has a major role. There's a lot of factors that go into overall nutrition that can help expedite healing. It can help with overall fatigue levels and blood pressure and cholesterol. And you know, there are specialists, and we have a nutritionist and a registered dietitian that is on staff here that can speak with the patients when you know, when they would like some consultation on nutritional, you know, any nutritional guidelines to get them you know, for healing and for either weight gain or weight loss. But a lot of times it's there are specific foods that are good for, you know, that can help with inflammation, for pain. So there's all different types of foods that have been studied that can help with that.
Yeah, you just mentioned the word inflammation. Can inflammation occur even if you don't overexercise or you don't do anything particularly wrong? Explain inflammation to me. I know it sounds childish in a way, because everybody understands, you know, it's something to do with making, you know, certain areas feel, how do I say it, Scott? Feel what? What do you feel?
Well, inflammation is your body's response. It's your body's protective mechanism to a stimulus. And sometimes it can be something as simple as, you know, a tendinitis from somebody playing tennis, and you have inflammation around that tendon because the inflammation is your body's reaction to protect that elbow, to protect that tendon. So it gets inflamed, and that inflammation ends up causing swelling in that area, and usually swelling can cause pain in that area because of the, you know, compression of the blood vessels, compression of the soft tissue in that area, and increased blood flow to that specific area.
Yeah, and you know, I know that there are things that I don't know that you know, and if you were to give our audience, you know, some advice and some real interesting information, what would that be? What would you tell them?
Well, you have to keep everything very, very simple when you're talking to, you know, to patients, to an audience like this. And the main rule is if you're doing a movement and something hurts, don't do it. You're either doing something wrong, or that's a way that your body is telling you that you're either overdoing it, or the movement is not, you know, it's not agreeing. Your body's not agreeing with that specific movement. So you must listen to your body. I also recommend very highly that if you're going to start any new activity, or you're going to get back into a specific activity that you have done but you haven't done in a while, that you need to get into it very slowly and incrementally. So if you're going to get back into a walking program and you haven't walked at all in 6 months because of an injury, you start by walking, you know, maybe at 3-4 minutes, a quarter mile, if that. And you have to see how your body responds to that. If there's pain while you're walking, then you stop and you continue at that level, or even a little bit less. And then you start increasing slowly. So follow that with every level of patient, all the way up to your professional athlete. your baseball pitcher coming off a shoulder injury will never get right back onto the mound to pitch in a game. There's an entire program, and it's going to take weeks, if not months, to get them back to that playing shape.
Yeah. Well, my guest today has been Scott Miller, who's a physical therapist in Florida, and he's got great advice for people, and he really knows his stuff. Scott, if people want to get in touch with you, how do they do that?
The easiest way to get in touch with me is if you have access to a computer, Miller Physical Therapy in Delray Beach, Florida. There's lots of links to lots of great articles and information about us and just about the body, and you can go right online and right on our website. There's lots of ways to get in touch with us, whether you want to give us a call and speak with me regarding any specific injury, or if you just want to, if you're not from this area and you just want to send an email, you can certainly help out and answer any questions or do any consultations via email or over the phone. So, the internet is really a great tool to get in touch with us, and that's Miller Physical Therapy in Delray Beach, Florida.
Thank you very much, Scott, for being on the Susan Brender Show. It's been a real pleasure, and I hope that you come back and talk about some of the new things that are happening in this field of physical therapy. And I'm sure our audience learned a lot. So thank you again for being on my show.
You're very welcome for having me. I always appreciate being on the show and giving some advice and information that your audience may not already know. So thank you again for having me.